Pressure in the head. Main causes. Various health conditions can cause a feeling of pressure in the head. Some of these issues, such as a sinus infection or a problem with the ear, can be easy to treat. However, intense pressure or pain in the head can indicate a severe underlying medical conditions. Causes and other symptoms. The following conditions can cause a feeling of pressure in the head. Tension type headache or TTH. According to the American Migraine Foundation, about 75% of the general population experiences tension type headaches or TTH. A TTH can cause a sensation of a tight band or vice squeezing the head. Pain of a TTH ranges from mild to moderate. According to the International Classification of Headache Disorders, TTH fall into three categories. Infrequent episodic TTH occurs once or less often per month on average. Frequent episodic TTH occurs 2 to 14 times per month on average. Chronic TTH occurs 15 or more times per month for at least 3 months. Experts do not know exactly what causes TTH. However, these headaches may develop as a result of muscle tension, stress, anxiety or depression, poor posture. Sinus infection and sinus headache. Health issues such as seasonal allergies and upper respiratory infections can cause inflammation in the nasal passages and sinuses. This can result in a sinus headache. A sinus headache causes a feeling of constant pressure in the front of the head. A person may also experience the sensation in the nose, ears, cheekbones. Migraine. Migraine is a neurological health issue. It can cause headaches, and this may involve intense throbbing pain on the sides of the head. A migraine headache usually affects one side of the head at a time, but it can affect both. Migraine is more common in females than in males. According to the Office on Women's Health, nearly 29.5 million people in the United States experience pain and other symptoms of the condition. In addition to pain, migraine can cause sensitivity to light or sound, vision problems such as blurred vision, partial vision loss, or the appearance of flashing lights, nausea, vomiting, or both, fatigue. The exact cause of migraine remains unknown. However, genetic and environmental factors may influence a person's risk. Ear problems. A dull, aching pressure on the side of the head, face, or jaw may indicate an ear infection or a vestibular migraine. Symptoms that usually accompany ear-related problems include pain in the ear, jaw, or temple, dizziness or vertigo, trouble hearing, tinnitus or a ringing in the ears, vision problems, fluid discharge from the ear. Meningitis. Meningitis is a rare medical condition that causes inflammation of the membranes surrounding the brain and spinal cord. These membranes are called the meninges. Meningitis typically develops after a viral or bacterial infection enters the bloodstream and travels to the brain. The infection then invades the tissues and fluids in the brain or spinal cord. Other causes of meningitis include infection with fungi, infection with parasites, certain medications, lupus, some head injuries, some cancers. Inflammation in the brain and spinal cord can cause severe head pain, as well as a stiff neck, a fever, fatigue, sensitivity to light, mood changes, a loss of appetite, confusion, nausea, vomiting, or both, seizures. Brain tumor. A tumor in or near the brain can increase pressure inside the skull. The American Cancer Society provide the following general list of brain tumor symptoms: headache, nausea, vomiting or both, fatigue, blurred vision, dizziness or a loss of balance, personality or behavior changes, seizures, coma. Brain aneurysm. An aneurysm is a bulge or protrusion that forms in a blood vessel. Aneurysms develop due to a weakness in the blood vessel wall, and the protruding region can fill with blood. A brain aneurysm can press against nerves and brain tissue, causing the following symptoms: numbness, weakness, pain above and behind the eye, pupil dilation, vision changes, paralysis on one side of the face. If a person does not receive treatment, a brain aneurysm can burst or rupture, filling the surrounding tissue with blood. If this happens, a person develops a sudden severe headache. Other symptoms of a ruptured brain aneurysm include double vision, a stiff neck, sensitivity to light, nausea, vomiting or both, seizures, a loss of consciousness, stroke. A ruptured brain aneurysm is an emergency. Anyone with an aneurysm that they believe has ruptured should contact emergency services immediately if they have any of the above symptoms. When to see a doctor. People should see a doctor if they experience 14 or more headaches per month. The following types of headache also require medical attention: sudden severe headaches, headaches that last longer than a few hours, constant headaches that are always in the same location, headaches that become more severe when changing body positions. Sometimes other symptoms accompany head pressure and pain. People should seek medical attention if they experience any of the following: stiffness in the neck, weakness on one side of the body, slurred speech, difficulty walking, fever, night sweats or both, eye or ear pain, nausea, vomiting or both, vision changes, seizures, loss of consciousness.